Point of care ultrasound in primary care. Time to get on board. This podcast explores the growing role of point of care ultrasound, or POCUS, in primary care. Today, we discuss practical applications, challenges in implementation, and tips for providers looking to adopt POCUS in their practice. Dr. Tatiana Havryliuk is an emergency physician and founder of Hello Sono. With 15 years of experience using POCUS in diverse settings, from urban EDs to Everest Base Camp, she is dedicated to extending its benefits to more patients. With Hello Sono, she and her team support practices in building compliant, high quality, and profitable POCUS programs through tailored education and implementation. This topic is important because POCUS is crucial now as it enables faster, more accurate bedside diagnosis, improving patient care and reducing costs. Affordable, portable devices make it accessible for small practices, and with growing use in medical training, providers must stay updated to stay competitive. So Dr. Havryliuk, thank you. Thank you for joining us today.
Thank you for having me. I'm super excited to be here with you, Randy.
Excellent. So just to kind of start off with some basics, for listeners unfamiliar with POCUS, how would you describe it and what makes it a really invaluable tool in primary care?
This is actually a big question, so I'll take it in two parts. One is, what is POCUS? So POCUS is a quick bedside ultrasound that is performed and interpreted by a clinician to answer specific questions and guide management in real time. It is different from a comprehensive ultrasound that's typically performed by ultrasound tech and then interpreted by a radiologist. And there are a couple of differences. Number one is the duration. POCUS takes 2 to 5 minutes, maximum maybe 10 minutes if you're doing multiple systems that you're scanning. A comprehensive exam takes about 15 to 20 minutes to complete, and then you have another few hours to a few days to get a report from the radiologist. Another difference is who is performing it, who's the operator. So POCUS is typically performed by a clinician. It could be a physician, a nurse practitioner, a physician assistant, while a comprehensive ultrasound is something that's done by a trained ultrasonographer. And then also there is a big difference when I'm describing POCUS is the type of exams you're doing. So you can use POCUS to perform diagnostic exams and also for procedural guidance. Something like doing joint injections or phlebotomy or paracentesis, you're using POCUS in real time to guide that procedure. So oftentimes POCUS is almost like a first step in the evaluation of patient and deciding, does this patient need further imaging?
Yeah.
So that's kind of my first take on what is actually POCUS.
Yeah, and I think that my familiarity with it is I've been through some hands-on courses, not being a clinician. It's more of my patient. I'm more of a patient perspective when I think about tools like these, and knowing what it can do. It just seems like such a simple, logical first step. I think people are probably a little bit apprehensive when it comes to using it properly, obviously, to make sure that you can see what you need to see. The interpretation, and then, of course, the costs of getting into it. And from what I understand, a lot of these things are a lot simpler and easier and better. Now, talk a little bit, expand on that a little bit and talk about the common clinical scenarios in primary care where POCUS could make a significant impact, and talk about what some sort of its uses, and just to kind of resolve some of the apprehension people may have.
Totally. I mean, some big use cases in primary care would be, for example, evaluating for a DVT, a deep vein thrombosis, in a patient, maybe low to moderate risk, or maybe a high risk patient. And you can do POCUS, and if you see a clot, you can start anticoagulation right from the clinic or your office. And hopefully you also get to avoid sending this patient to an emergency department. Once you do a POCUS, you're almost buying time for the patient and yourself. You might still get a confirmatory test, but in a few days rather than emergently. So that's one use case. Another one would be evaluation of patients with respiratory symptoms that come to your clinic. You can look for pneumonia, pleural effusion, pulmonary edema, and this test, lung ultrasound, is actually more sensitive than a chest X-ray to pick up all of those diagnoses. I think a great use case is for CHF patients, figuring out if they are fluid overloaded and titrating their medication without needing to get a chest X-ray and sending them for more acute care in the emergency departments. Oh my God, there's so much more. I mean, soft tissue infections, looking if there is an abscess that needs drainage, for example, chronic musculoskeletal pain, looking for joint effusions, looking for tendon issues. You know, is there tendonitis, for example, a tendon tear? You can do all of that with POCUS. I mean, another thing for primary care would be screening for AAA, abdominal aortic aneurysm. That's something that you can do with POCUS quite easily. And obviously also guiding procedures like joint injections,
Yeah.
paracentesis. I mean, and you touched already on the benefits and the impact for the patient. And I think it's huge. It's patients are getting better care, more efficient care. That's saving the time, the costs, and hopefully avoiding ER visits. And I was just going to mention, there was a primary care study done in Europe on about 800 primary care visits. And basically what they found that 95% of patients who got POCUS reported improved level of service, and 65% of them said that they trusted their physician more because POCUS was performed. So it's pretty incredible.
Well, and I can tell you, if you can save the number of visits, I think everybody's for that, all across the board. So what's the, I guess from zero to starting to use it, is it a continuing education process to kind of build upon your base layer of knowledge? Talk a little bit about the training process and what someone would, where they would start learning to do some scans, and then, equipment costs and things for portable.
Yeah, so really, there's kind of different modalities that you can use to train in ultrasound. So there are online courses that a lot of times we will start off people with doing some online videos, assessments, and then having them do a hands-on workshop. So I think the hands-on portion is quite important. And then usually there's a preceptorship period where the learners are actually collecting educational POCUS exams and having them, interpreting them, and then submitting them for review, but they are still getting confirmatory tests on those patients. So in general, like ASAP's guidelines and AFP guidelines, they recommend having 25 educational exams for each exam type. So if you're learning lung ultrasound, you should have 25 lung ultrasounds kind of done, interpreted, and submitted for review, and you should be getting feedback on those while you're still getting chest X-rays or some kind of imaging on these patients, right? Just to make sure for quality assurance purposes.
Yeah.
So that's kind of the process of just getting the initial credentialing, is this online, in-person workshops, and then this preceptorship. And then obviously to maintain your credentialing, there are recommendations on that too. And that would be performing a certain amount of scans each year. And also getting some CME or continuous learning medical education on these. Usually it's 2 to 5 hours every 2 years. It's kind of more or less the standard.
Yeah, that's pretty straightforward. Um, so is the equipment expensive? Are the prices coming down? Is the technology getting better? Kind of talk a little bit about the technology itself and
Yeah, it's been really exciting in the POCUS field. So in the ER, we've been using POCUS for over 20 years. It's been required since around 20, 10, I believe, for the residents to actually get training in residency and have formal education in POCUS. So we've been using it a lot, and we've been used to really big ultrasound machines that are card-based and you wheel them around, right? And in the last 5 years or so, now we have all these handheld devices that have come out, and there's quite a few of them, and they're pretty good for basic imaging. And the cool thing is they are also coming with a lot more affordable price tag. So something that used to cost $20,000 to $40,000, you are now getting for under 5,000. So
Oh,
maybe
wow.
3 to 5, right? So it's pretty affordable. I remember um, one of the first devices, handheld devices that came out, I used my CME money and it was $2,000, and I still have it and I still can use it. So
Wow.
yeah, the technology is a lot more affordable. There are things you gotta think about, because you don't just need, you do need the probe, the ultrasound device, but you also need a way to store your images to be compliant for billing, for medical legal reasons. So one of the things you'll often buy is also some kind of subscription to a cloud storage, or like a Frank middleware that lets you actually do this QA process if you have a lot of learners who are learning POCUS. So that's an additional expense there, and that can, have a pretty big range depending how robust this middleware is going to be, and it could start anywhere from $4,000 a year to $50,000 a year, depending if you are within a hospital system in your department and it's going to involve like a huge implementation effort, then those middleware options can get pretty expensive.
Oh, yeah, I bet. So on the revenue side, reimbursement, is that, and again, it's been a while since that, I've been involved with it, but I'm assuming that's gotten better too. And I would imagine students coming out of school are sort of expecting to use these kind of tools now since they're being trained on them.
Yeah, yeah, and there is reimbursement. I mean, POCUS comes with its own CPT codes. The CPT codes are for limited ultrasound, and the global fee for POCUS ranges anywhere from around $50 to $180, depending what device you use, and that's based on Medicare, not device, sorry, depending on what exam type you're performing, and that's based on CMS fees for physician-performed exams. So there's definitely reimbursement there. And my estimate is if you are performing about 2 exams every day for POCUS exams, and so you're performing about 10 every week, your reimbursement could be anywhere from $30,000 to $70,000 a year,
Wow.
which could really pay for the whole program and also bring additional revenue.
Yeah, and the improved quality, because I think again, coming at it from a patient's perspective, I think if something's going on, the sooner that you can find out, the better, and the fewer trips you need to make, the better too. And I think that this always made so much sense to me to have these although in most primary care settings that I've been in, at least in it's referred to someone else or it's not done right there, which would be great if it was done right there. So I'm right there with you on that. So what are maybe some of the barriers? I know we kind of touched on some of them, but you provided a lot of context for it. But what are some of the hesitancies or the barriers, I think, that people maybe say, well, I'm not sure if I want to do this. What are some of the things that kind of maybe keep someone from actually pulling the trigger on it?
Yeah, I've been encountering kind of their top three. I would say the top three are just lack of competency, lack of funding, and also this whole like administrative, technological confusion. Those are the top three. And then there's some people tend to have concern, like medical legal concern. Am I going to get sued because I'm doing POCUS? And that's been debunked by multiple actually studies looking into this. But yeah, to just take those top three right now, I mean, lack of competency in POCUS among primary care physicians is definitely a big barrier. So even if there's a residency program that wants to introduce POCUS, they don't have enough attending physicians trained in it. So it makes it really challenging to really roll it out. However, there are also, solutions. Right now, there are a lot more options for POCUS education, including online workshops, even image review. That's something that Hello Sono offers. So there are definitely options outside even of your own organization if you don't have trained providers. Um, and then lack of funds, I think it's traditionally been a big barrier because people were expecting to need $20,000 to buy just an ultrasound machine. And then, the whole setup cost and then training the providers. So now that barrier is a little bit less of a barrier, I think, because we can get more affordable devices. Yeah, and lastly, it's that administrative and technological confusion. And this is really one of the reasons why I started Hello Sono, is help people kind of sift for the administrative barrier. There are all kinds of guidelines from American College of Emergency Physicians. Those are probably the most robust, and the rest of the guidelines for other specialties are based on ASAPs. There are also various position papers. AFP has a curriculum for family medicine residents. But they're all just guidelines, right? There's not like, this is the requirement, this is what you do. So I think there's just a lot of variability, how people are implementing it, what kind of workflows they are building. Some people don't even know what's available for the workflow. And then, most people don't know they need to have protocols, for example, infection control protocols for how you're going to disinfect these devices. What's your credentialing protocol? Are you going to let providers bring in their own ultrasounds and scan patients in your clinic? That's usually
Oh,
a no-no.
yeah.
So there are all kinds of things. And then obviously the billing part as well. What do you need for billing? Um, how do you document this? How do you store this? So there's just a lot of things that go into it that are hard.
Yeah. And it sounds like just sort of getting started. And I think, like you said, there's lots of resources. So what's the best way for someone to contact you to get started?
Oh, wow. Well, you can go to Hello Sono website, hellosono.com, HELLOSONO.com. You can also email us at info@hellosono.com. I'd also encourage you to use the POCUS ROI calculators that we have on our website. And that's really to show you that there is a potential revenue in this. And when you're making a financial case to introducing something like this, that could be a really important tool. So yeah, those would be the ways to get in touch
Yeah, and
and
that's
explore.
probably the biggest driver for adoption, I would imagine. If I think what it is and what you can do with it is really amazing, and I think just sort of if it's a way to generate revenue and provide a higher level of care, higher level of quality, I think then those are two big reasons to get started. So uh, thank
Totally.
Thank you for joining us today and sharing, and we'll look forward to speaking with you more on maybe some of the more specific areas clinically that we can talk about. Taking some of the different, I guess, taking it apart, maybe so to speak, in future podcasts.
I'd love that. Thank you for this opportunity, Randy.
If you found this content valuable to you, please consider joining SMA by visiting sma.org/membership or making a tax-deductible donation. Visit sma.org/give to support our mission. Thank you.